Blepharitis is a condition that plagues many patients. Dr. Jim Reinerson recently published an interesting paper looking at this condition and how it may in fact be the underlying cause of a number of the ocular surface conditions that we treat. In this article, he suggests the use of a new term, dry eye blepharitis syndrome. Throughout the paper, Dr. Reinerson describes lid margin disease involving several steps, including bacterial survival, biofilm formation, overcolonization, quorum-sensing gene activation, virulence factor production, and inflammation. He proposes that these virulence factors are likely the culprits that cause follicular inflammation, then meibomian gland dysfunction, aqueous insufficiency, and finally, after many decades, lid destruction, as evidenced by entropion and ectropion. Dr. Reinerson adds insights into our understanding of blepharitis and the potential connection with dry eye. As such, it's incumbent upon us to be vigilant at treating this chronic condition. Regardless of the etiology, it's important to appropriately rid the lid margin of excessive scurf and microbial overpopulation. We view this as a two-step process. The first is a mechanical removal of the excessive biofilm and deposits from the lid margin. Traditional wisdom would have us consider a moistened cotton tip applicator as an appropriate method for doing this. Unfortunately, this is a very difficult process to perform on patients because it oftentimes requires significant force to remove the visible debris at the base of the lashes. Newer technologies are now available that address a number of the shortcomings of the cotton tip applicator for the removal of biofilms from the lid margin. On the left side is the technology being used on a patient. Because of how quickly the end spins, only a light pressure needs to be applied to the lid margin to remove the excessive biofilm. The second step in providing these patients extended relief and the best chances of low levels of excessive biofilm returning includes some type of long-term maintenance therapy. There are a number of products that help in these efforts for patients. Shown here are some of those products. With the number of products available, it's incumbent upon us to provide a recommendation that's easy and manageable for our patients to use. Blepharitis is a prevalent condition, and we have new insights as to how this condition may be at the root of other ocular surface conditions. It's important for us to actively manage this condition through currently available technologies, and also to provide appropriate maintenance therapy. In doing so, we'll make sure to optimize patient outcomes and minimize future progression of disease. This will improve the quality of our patients' lives, which is ultimately why we do what we do. We hope that this has been clinically insightful.